Assalamualaikum warahmatullahi wabarakatuh. I am Almira B. Salongan. Good day everyone. Today I will be discussing Chapter 12 titled Schizophrenia and Other Psychotic Disorders, written by Tarrier and Rumina. This chapter mainly focuses on how cognitive behavioral therapy or CBT has been developed and applied to people experiencing schizophrenia. So let's proceed. So we have the development of CBT for schizophrenia. First, let's talk about the development of CBT, CBTP or Cognitive Behavioral Therapy for Psychosis. It was designed because medication alone weren't enough for many people with schizophrenia. CBTP helps patients manage persistent symptoms like hallucinations, delusions, not necessarily to remove them entirely, but to reduce their distress and build better coping skills. It combines cognitive strategies like challenging negative thoughts and behavioral techniques like reality testing or distraction. Next, we have the research evidence. Now, what does research say about its effectiveness? For people with chronic schizophrenia, CBTP works well in reducing positive symptoms like hallucinations and delusions. It also helps with depressions and negative symptoms like low motivation. The improvements can last even after therapy ends, especially if the person keeps using the strategies. But for those in the acute phase, the evidence is inconsistent. Some studies say CBTP helps in early recovery, but others don't show much difference. So it's not a replacement for medication during acute psychosis. It's more like complementary tool. So we also have the relapse prevention. In terms of relapse prevention, regular CBTP alone doesn't always present relapse, but when it's specifically designed for relapse prevention and the patient sticks to it, it can reduce relapses rates by 21%, so commitment and consistency are important. Next, we also have the early intervention. Early intervention is another area where CBTP shines when used along with family therapy, especially in early intervention services. It leads to fewer hospitalization and lower relapse rates. However, if CBTP is used in the promodal phase, the phase before full-blown psychosis, it can reduce some symptoms, but it doesn't guarantee prevention of psychosis. Next, let's now focus on the summary of evidence about the effectiveness of CBT for schizophrenia or CBTP. Number 1, effective for chronic symptom management. Research consistently shows that CBTP is most effective for people with chronic schizophrenia, meaning those who have been experiencing symptoms for a long time. It helps reduce positive symptoms like hallucination and delusions and improves depression and negative symptoms such as lack of motivation or emotional flatness. Most importantly, patients who continue to apply what they learn in therapy can maintain the benefits even after treatment ends. Second, we have the inconsistent results in acute recovery. However, when it comes to people in the acute phase, meaning those who are currently having an intense psychotic episode, the results are not consistent. Some studies show that CBTP helps speed up recovery, while others show no significant difference compared to standard care. That's why CBTP should not replace medication, especially during acute psychosis. It works better when used as a supportive or complementary therapy. Third, we have the moderately successful in relapse prevention. CBTP on its own doesn't always prevent relapse, but if CBT is specifically tailored to focus on relapse prevention by combining both cognitive techniques and behavior-focused strategies, it can be effective. One study found that this version of CBTP could reduce relapse by around 21%. However, the key is therapy completion and patient engagement. If the person doesn't attend regularly or doesn't apply what they learned, the benefit may not hold. Fourth, we have the helpful in early intervention. When CBTP is used early in the illness, especially in early intervention services, and combined with family therapy, outcomes are significantly better. Patients show reduced symptoms, fewer hospitalizations, and lower relapse rates. This shows how important it is to offer support as early as possible, especially to young people showing early signs of psychosis. Lastly, we have the limited in preventing psychosis during prodrome. Lastly, in the prodromal phase, this is the stage before full-blown psychosis. CBTP can help lessen some symptoms like anxiety or odd thoughts. However, studies show that it doesn't completely prevent the progression into full psychotic disorder. So it can be helpful for early emotional support, but it's not enough on its own to stop the illness from developing. So in summary, CBTP is reliable and effective for managing long-term symptoms. Its success in acute psychosis is mixed. It helps reduce relapse but only if designed for that purpose and followed through. It's very useful in early stages, especially with family support. And also, it offers some help during prodrome but cannot stop psychosis completely. So, mag-proceed naman tayo sa theoretical advances. Most people think schizophrenia is only a biological illness, but this chapter or this discussion reminds us that psychological and social factors matter too, especially for relapse and recovery. The stress vulnerability model explains how stress can trigger psychosis in someone who is biologically vulnerable. CBTP also uses cognitive models like the one by Garretti et al. To understand where delusions and hallucinations came from and how to address them logically. These newer models help therapists design better, more targeted CBT approaches, for example, focusing on reducing suicidal thoughts or emotional distress. Okay, proceed naman po tayo sa basic clinical principles. CBTP is more than just talk therapy. So, here's what happens during actual sessions. We have the build a strong therapist-patient relationship, create a personal case formulation linking thoughts, symptoms, and behaviors. We also have teach coping strategies like distraction, relaxation, and realities testing. And we also have the help patient challenge their belief about hallucinations or delusions. They might use the Socratic method, also called the Colombo technique, where the therapist gently asks questions to help the patient rethink their beliefs. If a delusion is too fixed, the goal shifts from changing it to reducing distress. Also, building self-esteem and teaching positive self-talk is a big part of therapy. So, magbibigay ako ng example. A woman believed her thoughts were being broadcasted. This made her isolate herself from others. Through CBTP, she learned how to test her beliefs, and over time, she regained social confidence and improved emotionally. It shows that even if the delusion stayed, her quality of life still improved through the help of CBT. Ngayon, tatalakayin ko naman ang background at mga kaugnay na factors ng schizophrenia at kung paano ito nakalink sa mga layunin ng CBTP treatment. Dito explain kung paano iba-iba ang mga phases ng schizophrenia at kung paano dapat i-adjust ang treatment depende sa stage ng illness. Ang tawag dito ay phase-based approach. Hindi pwedeng one size fits all ang therapy dahil iba-iba ang bawat nararanasan ng bawat pasyente sa bawat phase. Proceed tayo sa phases of schizophrenia and corresponding treatment aims. Sa prodromal phase, ano ang symptoms? Ang symptoms niya ay anxiety, depression, insomnia, at magical thinking. Yung feeling na may kakaibang kahulugan ang mga bagay. So, ang treatment goal dito, prevent psychosis. Sa phase na ito, CBTP is used to manage stress and emotional issues before it turns into a full-blown psychosis. So, sa acute phase, ano ang symptoms? Dito na lumalabas ang severe psychosis tulad ng hallucinations, delusions, at extreme confusion. Ang treatment goal dito, speed up recovery. CBTP works here by helping patients understand and cope with their experiences habang sabay pa rin ang medications. Next, ang remission, partial remission. Ano ang symptoms? Meron pa ring residual symptoms, halimbawa, natitira pa rin ang ibang hallucination or delusional thoughts pero mas mahina na. Ang treatment goal dito, prevent relapse and manage lingering symptoms. CBTP helps patients apply coping techniques and reduce the emotional impact of symptoms that remain. And lastly, we have the full remission. Ano ang symptoms? Halos wala na. Stable na ang mental state ng patient. Ang treatment goal dito, maintain wellness. Focus ng CBT dito ay para tulungan ang pasyente bumalik sa normal life routines, mag-set ng goals, at manatiling mentally healthy. So, yun lamang po. Doon lang po nagtatapos ang aking report. Thank you po sa pagkikinig.